Okay, so on this sample, the hair mineral analysis request, as I mentioned earlier, you will prepare the client's name, address, postcode, age, sex, and whether they're pregnant or not, and if they're on medication particularly, that also needs to be known, and what occupation. I seldom ever put that in. I've only ever sent the above details. Now, the date of sample, of course, make sure it's all filled out. Now, natural hair colour or hair preparation, shampoo, conditioner, hair dyes, you need to either isolate. There's never enough room on these little lines here. I usually either put it on the back if it's not too extensive, or ask them to bring in a list which is then attached to this one and sent to the laboratory. It's requested by, which means that it will come back to your clinic if you're the one organising it. You may pay up front and then ask your patient to pay when they come to collect it and go through it with you, or you may want them to just go and do this themselves, in which case they will have it sent directly to their own home address, which you will then put in requested by. But always mark down if you want an extra copy of doctor's report given with that, so that you have a report and keep a record of that client and what was found in their test. The hair is taken. Oh, okay. Well, the hair is taken. Truly, it's not difficult. It's all you need to know is to take a piece of hair, preferably from the back of the head. So now there is a picture here that tells you, and it's only a small amount. They say if you can put the amount and then put it on a pen and weigh it, okay, and if you can, is that right? And then you just, is that the amount? Yeah. If it balances, yeah, it's all, the information is on the packet, so it's only a small amount, and put that hair in to the packet. With that, send it in an envelope. 2 to 3 weeks later you have all the results. And as I said, it was probably about $110 or something for the test to be done, and I'm sure the client doesn't mind if you're going to organise it, because you're going to sit with them when they come back and go through the graphs as well. So then that's up to you, whatever price you put on it. Different clinics charge an extra $10 and even up to $30 and $40. I think Francesca does it as well, and I think it's about $40 from their clinic, approximately $40. No. Oh, they're saying there's one now in Melbourne.
There are 2 machines in Australia. One is with the CSIRO, which you don't have public access to, and one is now in Queensland. This man spent $1.5 million on the machine, and he is now also doing hair analysis, but we haven't seen a report yet.
Okay. So alright. There are 2 in America.
To America.
Australian Biologics do it too.
Yes, they do, but they don't do it here. They're all sent to America. Interclinical laboratories, that is with Dr. David Watts. He's quite famous in his books on mineral therapies and the balance of minerals, the right composition and balance, and I think he's a biochemist, so his background's in biochemistry. That's his laboratories. The other one goes to Smoky Laboratories, and we've never seen a good report back from them. It's like one big sheet with graphs on it, often in very bad print, and telling you a few markers of excess or deficiency, no full detailed report. For example, when you're looking at some of this, and you might find that the patient has adrenal insufficiency or really the thyroid imbalance, which will show up on their hair, and they'll tell you, don't eat fish oils, because too much vitamin D suppress the uptake of thyroxine as well. So it gives you a very comprehensive range. You learn at the same time as you're reading those reports. It's amazing what you keep picking up. It's absolutely wonderful. Okay, so that's another test that you can offer your client in service.
Catherine, if the person is bald, do you then recommend them to take a sample of their pubic hair?
Yes, that's right. Sorry, yes, thank you for that. Yes, if they're bald and obviously have no hair to give, they take pubic hair. If the hair is heavily dyed as well, it's often better to take pubic, or if they have enough underarm hair or any other extra body hair. If it's a man with lots of hair on his body, you can often cut off enough from back or chest, depending where it is. Yes, thanks for that. Yeah. Okay, and even babies, they have very fine hair and things, and you may have a child who's very sickly. And I might tell you that the CSIRO are open to the public only on special occasions, and there's just been one case of a child who at the age of 4 was in and out of hospital, and very, very pale, very weak, sickly, not eating, vomiting, wanting to sleep most of the time. And the mother, being pregnant with the third, having another little boy younger than this one, she was beside herself because the child was spending more time in hospital than out, and all they ever did was take blood from him. So of course the child was more and more anemic as well. And the hospital still could not find the cause, but they said he was just a very sick boy. And when he came, I was telling you earlier about that wash in the eye over the brain area. Well, this little boy had a terrible wash. He didn't have a sodium ring, but he had a wash. So I suspected lead because of my history from that woman. And this is actually only about 4 years ago. And I felt that it was lead. And I questioned the mother about the room the child slept in, about the house. See, these are questions that you're going to think about. When we talked last time about the environmental toxins, old houses are often covered over with lead paint. Well, if they're not painted so well, there's also leaching and dust and vapor that emit from lead. And what happened was, this woman, I told her to go and get a lead kit and test her home. Well, she ran from place to place looking for this lead testing kit, which I had seen in Canberra, but I had not seen up here. But I told her I thought it was through Bunnings or one of the stores that I saw this lead testing kit. And I told her, well, she ran everywhere, and she was really, and in the meantime I was treating him for leaching of lead and using all the vitamins and things to build him up, and he was actually improving. But finally, in desperation, because she had about a month to go for this baby to be born, and she began questioning too about her house, and realized that her house was built in the 50s when they were still using lead paint, but it had been painted over and there was carpet all through the floor. She finally called CSIRO because she knew that they would, and she screamed at them. She rang the health department. They put her in touch with CSIRO, screaming and saying, look, my child has been ill, I don't want this, what if this happens to my baby? What if this naturopath is right and it's too much lead? Please test it. They put her down to being a neurotic mother ready to childbirth, and she's just hormonal. Just let it go, and we'll send someone out. 2 weeks later, a man came out, and he took dust from her carpet, dust from her skirting boards. He took dust from the walls. He went round the eaves of the room. 2 days later, the truck came. They had the whole family taken to a hotel, and the whole house was stripped. There was 28 times higher lead content than the allowable most toxic level. They found that the house had been coated with many coats of lead paint, but it had had 2 or 3 coats over that, but it was still leaking. And it was too severe to take it out, so they suggested 6 coats of paint. But mind you, the family had to end up paying for it, but at least she got to the bottom of the problem just prior to giving birth. In fact, she was still in the hotel. They were still in the hotel because the health department came. She said it was like a movie out of Star Wars. They came gowned from head to toe with the white truck, and they had big masks, and the whole truck, they just took that whole family out of her house, transported her to a hotel, and they completely removed every bit of carpet and cleaned every bit of her house up and tested every other area of it. Well, where she called him Con, but his name was a very long name, Constantinos, that's right. She was calling him Dino or something, but his name is Constantino. And you know, when someone is sick, now I know this is slightly feng shui now, but when someone is sick, the name D is given to that child, D, and the letter D is like a person lying down. Death, despair, depression, it's all D, and disease, and everything with D. So what the Chinese would say is, it's a very ill condition. You make sure the name has energy that will help that child. So I made sure the mother called him Constantinos, not just Dino. Constantinos, emphasize the C, you know. And so the room where little Constantinos lived was actually the worst affected, but it was in the other room as well where the other little boy was, and he showed no sign of it until a year later. And a year later he began with all the same symptoms, and however we got him on track, and even the baby was showing signs from the womb. Yeah. So but she had it all tested. CSIRO ran those tests for her after that. So that was because they were pushed. They were pushed by this frantic mother knowing something was wrong. The doctors and the hospitals did not know what was wrong with that child. Now, you see, now I wasn't sure if it was going to be lead. I did not know for sure. I just maybe intuitively felt, after having the history of that woman, see how the patients are your teachers? They're your greatest teachers. I didn't know 15 years ago what that marking meant, but she taught me. She came back to me, and that's how I recognized what it was. But would mercury show the same? Would cadmium show the same? Would excess zinc, people who use photocopiers, look at the excess zinc that radiation that hits their body, very, very high levels. You know, dyes, working around machine dyes, printers and things like that, they all get excess toxins in the system. But how do we understand to isolate them? Yeah, maybe one day. At the moment, okay, so you can use interclinical laboratories. You can send them to Dr. Flura. If you wanted something, if you felt the patient was not responding to whatever treatment you had them on, you realized, yes, there is an imbalance. Mind you, I wasn't aware of these people longer than 4, so it might have been 5 years ago now, this little boy, because this became available to me after that little boy, otherwise I'd have sent them for a hair test too. Okay.
What is Dr. Flura's chelation therapy involved in?
It's intravenous.
Okay.
You're there for hours. There was Dr. Heather Bassett as well on the Central Coast, who for over 20 years was doing chelation therapy. She's just recently retired now, but she would only take patients who were terminally ill, particularly mostly cancer patients, and she would have them there sometimes up to 6 hours on these machines, just having this chelation put through the blood very, very slowly, and they might go every day, and then eventually it would be cut down. There may be a year to 2 years to 3 years in treatment, but that's how long it takes sometimes to save a life. I failed to mention last week, men or women who use contact lenses. In fact, it was one of the workshops Leo did on one of the fertility managements. One of the lady doctors had recognized that the solution that they wash their contacts in has mercury. And just wearing contacts when people are allergic to the solution and become allergic to things after wearing contact lenses, that actually can render you infertile. It can be just something that simple as mercury. Yeah. So be aware if they're wearing contacts that they're best to go back to glasses during their detox and fertility processes. That will be found in the hair analysis though. You can lose hair, yes. People with a higher mercury level often get very thin falling hair. They get quite thin around the top.
People with amalgam fillings, do you advise them to get them removed?
I do. They can have them tested first. He's a dental surgeon in the city, Robert Gamble in Pitt Street. He runs a clinic that has a little testing machine where he can put it on the teeth and just test whether there's still amalgam or mercury left in the mouth. Now, if there isn't, sometimes he thinks it's too late, because people who chew gum constantly, gum is alum or aluminium, there's in chewing gum. When you chew constantly with any kind of alum or any other type of mineral constantly, that chewing also leaches vapor from the amalgam. That's why a lot of people later get stomach cancers too, because of the amount of chewing. And chewing, of course, you run out of your production of hydrochloric acid. If you're an A blood type, which has low stomach acids, which most of you here are A, low stomach acids, very soon you have digestive problems and slow your metabolism right down just from the fact that you chew. But leaching the mercury from there, what Dr. Gamble used to say is it's probably now in organ and brain, and sometimes it's too late. Now, if he still finds amalgam in the tooth, if you're a relatively young person, he won't bother testing you. But if you're older, he thinks sometimes do the test first and see. The nurses actually at his clinic can do that test for you. If there's still some amalgam left in the teeth, if there's still vapor there, then it will be picked up and detected on this monitor, and then you can choose to take them out one at a time. You know, we've got a lot of tests that we can refer to do for your patient. Checking the background of the patient and their financial position is what you also need to take into account. If there was a major problem with mercury, if you felt that there was that wash in the eye, perhaps this would be probably the first way to go, because this will tell you if you've got a higher level of mercury showing anyhow. But as Gamble said too, sometimes it's already out of the system and already settled in those organs, and unless you're going to do biopsies of the individual organs, you're not really, but they may suffer the symptoms.
How do they, is there any way of getting it out of the organs once it's in there?
Yes, there's I was just going to tell them actually, thank you, you read my mind, did you? Homeopathic formula CH7, have you heard of CH7? No, it's a homeopathic formula. It's designed by a professor up at that works with the Newcastle University. He's got two things now on the market. He's only ever had one because he felt that was all you needed, get rid of all your heavy metals. He's designed something else now as well, he's recently informed you of. But he also sells kits to do the urine tests. Now, that is another test that you may wish to offer for your client, because you can learn to read a dipstick. You can learn to read whether the albumin, the proteins, the sugars, the fats, and whether there's blood in the urine. You can learn to read that because there's a little graph showing you if it comes up this colour, this is the problem. If it's this colour, this is the problem. So anyone can offer that service. They just need to donate a little bit of urine. But this extra test that's done by this professor at Newcastle that does the CH7 homeopathic formula for leaching all heavy metals, he runs a kit too which gives you a colour for the different metals that are found coming through the urine as well. That's a separate little kit. I'm not sure the cost. 350 for that kit. And that's also worthwhile if you're going to have a serious practice where you can offer these various facilities. In general care, you may not need to use those, but we're talking people who have been trying to get pregnant for years and been on IVF and it hasn't worked. Okay, you may need to resort to some of these other tests. Just there may be an underlining thing that you've missed. Okay, so the CH7. Do we have the address or phone number of this man? I know that the practitioner, cartrician, and people, your suppliers, whoever you buy your products from. Some of you have a main supplier that keeps all brands.
Yeah,
Lifespan. I was thinking of Lifespan or cartricians. They have CH7 as well. So just look for it in your.
If all else fails, go to our website.
Yes, it's on the website, by the way. You can have a look up there. Okay, so that's another service. The teeth, that really is. I mean, I would advise everyone to get their amalgams out if they can afford it, even if you do one tooth at a time, if that's all you can afford, one tooth at a time. Admittedly, the Alzheimer's, the mercury is very high in Alzheimer's patients, as well as aluminium levels. And dentists, I'm not sure if you're familiar with, but they had the highest ratio of Alzheimer's. Yeah. Biochemists were the second. A lot of diseases of motor neurons are common in the biochemists, because they're always inhaling vapors. They're testing various chemicals one after the other. So their 6 and 8 years of uni, and then their work, whatever area they work in that field. So yes, they're breathing in those chemicals all the time. And the unleaded petrol, you thought you're getting off scot-free, getting it cleaner air with what they're using now, unleaded. What is it? It's cadmium, isn't it?
Instead of lead, there's now cadmium coming out.
Cadmium is more toxic than lead. It's a much finer vapor. It's absorbed into tissue, much finer than lead. Lead has to go through your channels, your openings, not through the skin. It can't get through the skin. The molecular structure of it is too thick, too large. But cadmium is smaller. It's vapor, so it's more toxic. Even just tobacco, though, has 47, and tobacco has 7% aluminium. That's why a lot of smokers get the brain disorders as well. They get very slow and sluggish mentally as they get older. Yeah. Go straight to the brain. Yeah.
How do you dose the CH7?
It's a small bottle, and you start with, they tell you to start with about 10 drops twice a day, and you work up to 15 drops. And you take it for 10 days, and then you stop, because their breakout side effects of CH7 is only after 10 days as a rule. And that's when you get rashes, red, flu-like symptoms. I gave this to my daughter because my daughter had an allergic reaction for some years while she was at uni. We didn't know why her hair was getting thinner and thinner compared to when she was a child. And she used to break out. She was allergic to everything. When you have a ratio of 1 to 100, hers was in the thousands. And the doctor could not understand why she was so allergic, even though she never went to doctors for medicine. While she was at uni, in desperation, she would go and just get this allergy thing done, and she found she was so allergic. We only found out later that it was actually the mercury in the contact lens that she wore, because she found it hard with glasses. They'd fog up or steam up, and she had to see the board. And we found out it was a contact lens. And since she stopped wearing them, she doesn't get it. She can eat just about anything, and she's so thrilled. And it was something so simple. When she was on CH7, we put her on it. On the 10th day, she broke out like you wouldn't believe. It was like the worst case of psoriasis all over her face. She was just raw, red raw, and she used to cry and cry because of this. But she knew she was going to get it, it was going to happen. We didn't know how severe, and it was very severe in her, particularly around her face. For other people, they've had different reactions. Some people break out in big boils, and other people have had different reactions with it. So, just be aware that there are reactions. Yeah. I find if I put it in during their detox phase, they know they're going to get outbreaks anyway. Let's get it over and done with during their first detox. When they come off the CH7, I'm not quite sure how many days you come off it. It could be 10 days as well. Everything seems to work around 10 days with them, and 10 drops, but it goes to 15. It's a 10-day break, and then you go back on it again, and then you have a 10-day break again until the bottle's finished. But because they're only small drops, only a small bottle, and it's not expensive, it's around $16, $18, is that it? A bottle?
Bit more now.
Bit more now, but it's not expensive at all. It's very good. Sometimes the doctor's report that comes back from the interclinical laboratories, they have a range of pills that one needs to take, and very few patients have to take less than 5 jars, but then the amounts of those 5, like 2-3 times a day, and you must take it AM, noon, PM, and sometimes bedtime. And then you may have to take 3 of one of another, 2 of another, and it gets very extensive because apart from those you're treating their other organs, and it's a lot of pills. When I had my hair done some time ago, was about 9 different bottles, and I just, in the end, I felt they were all coming back up. It was just so much. So you can do it for a while, but when you have to stay on these things for months, you do give up. And so with the patients, we found we would give them the CH7 alongside it to help detox them at the same time, so they wouldn't need to be on those minerals for very long. But it had made a lot of difference to a lot of people. See, when they're relatively healthy, it becomes a chore, but when they're ill or sick and have been for a period of time, people don't mind doing it for a while, and usually they're compliant for the first 4 weeks, 6 weeks. It's then after that, when they feel well, that they start to get a bit, down with the amount of pills. Yeah. Okay, is there any other questions about what we've covered so far? So it's mainly looking at the tests you can offer, how to apply them. Of course, if you can advise your clients to have their blood tests done at the doctor's, so that you can get the rhesus factor at the same time. Yes.
When would you test a child? For what reason?
Just for their blood group for food. Once they're on solids, and some mothers are actually putting babies on cow's milk at 2 months of age, and the child's full of mucus and so on. And if the parents are different blood groups, I think, well, let's test what the child is anyway, and then we'll know what to guide her, like whether they'll be more lactose intolerant, being an O. If they're a B, they may not be quite so bad. We could introduce a little bit of yogurt and things. And then again, if they're still being breastfed, the mother, whatever she's eating, if the baby's a different blood type, it may not suit the baby, and the baby's, complaining and stomach pains and reflux, which happens, and when we do the second part, you'll see what happens these days to babies. Babies are put on Mylanta, babies are put on Zantac, babies are put on all sorts of terrible drugs very young, because these days they've all got reflux. And if they're breastfeeding and they're O and eating all this meat, and the baby's only absorbing and digesting certain amounts of protein, and they're A, like maybe the father, whatever, they're terrible tummy pains and wind and screaming and screaming and screaming, because something is wrong. Okay, so you look at what the baby's blood group is. You can advise the mother to eat more of the foods that's more akin to that child, what the child needs.
Have you had success with doing that with mothers?
Yes, changing. Babies have settled. Yeah, oh yeah. And you give the mother and the baby dill tea, sometimes fennel tea, sometimes peppermint tea, sometimes chamomile, sometimes a combination of chamomile and dill. Yeah. That's just to help with the immediate problem. Even putting a little bit of slippery elm in their formula, if they're on formula. If they're still being breastfed, and they've got thrush and they've got gut problems, you can put a little bit of yogurt on the nipple, especially a good cultured yogurt, because the sucking action is what actually stimulates the macrophages as well and the immune system to attack bacteria. So the sucking action of the baby, that's what stimulates their immune response. And when you put the yogurt around the nipple and the baby sucks, it actually assists the baby to clean its own thrush, to get rid of the thrush. And of course that little bit that gets into the gut is so important for the gut. Oh, there's a lot of things you can do. Yeah, we'll cover that on the next phase. But the next course. Just looking at your patients, I always feel it's good to know their blood type, even if for the rhesus factor as well, because if they've got a history of miscarriage, and I've been through it before, just check that, make sure that they're not carrying negative rhesus. Yeah. The other things, we might just show you the other tests that can be offered to your client at the moment. You've seen these little ones for the temperatures. Okay, there's just a little cap. They come with caps. You've got so many that you can just fit over, just to keep it hygienically better to have a little cap on it so you can get rid of that. And it has a little beeper, and you just put it in their ear, and then it gives you a reading straight away. This you'll be using more when children are coming to the clinic and babies, and you think they might be, having a temperature, and the mother says, well, the child's hot, but then the child's always hot. But you can check. And this is very easy to take the baby's temperature and record what it is, and you'll know if the baby actually does have an infection or a fever of some degree. The next kit that you're going to need to keep in practice or to advise your clients is the ovulation kit, and this is for early ovulation. It's a one-step ovulation kit, and a bit like the pregnancy test. Have you all looked at a pregnancy test kit? No, it's just where you drop a bit of urine onto a stick and wait for a few minutes, and it has a little bar that comes across. If it's negative, there's one little bar that lights up or comes across with a colour, and if you're pregnant, it's two little bars that will come across. And of course everyone's waiting for that second little one to come up, and very disappointed when it doesn't. However, it could be that test has been done too early. Now, when a patient rings up and says to you, I've been on detox and I've had my natural cycle, and we're running a little bit ahead here because we haven't done the female side yet, but just remember that when she comes in and she says, oh look, I tried and my period's late, they're never late, I'm always 26 or 27 days or 28 days, I'm 3 or 4 days late, should I do a test? Often they've done it. They haven't really asked you, they've done it. And it's just too early, truly. Now, what are you looking for in that urine test? It's a hormone called HCG. Okay, that's detected in early pregnancy, but you really need to be at least 2 weeks for enough to come through the urine that you can be picked up on that little tester. So, yeah, just get them to wait. The longer they wait, the better. If the period still hasn't come, 2 weeks down the track, most possibly they are pregnant, but then it's confirmed. Do not send them for a blood test. Why do you need a blood test if the urine test is showing positive? Why confirm yet again with a blood test? Now, my apprehension against blood tests are, the moment conception occurs, the spleen takes over the manufacture of bone marrow in pregnancy for that infant. So the spleen, which is also the organ that stores your iron, has to now produce bone marrow, and the stored iron goes quickly to manufacture the blood needed for the placenta. The liver is involved in manufacturing the chemicals for the placenta, but iron in the immediate instant is used for placental development. When you suddenly put a syringe in the arm and withdraw a pint of blood, you shock the body because it's in that very first gestational period, and it's like a little shock. And they've seen that on graphs. The baby actually, the whole zygote at that stage, little fetus, actually gets a shock. And when the body is not used to being pregnant or has had recurring miscarriages, you must make sure that the body does not have a shock, because it thinks, oh, you know, we don't want this, and you may miscarry. You may just bleed the day after the blood test. It happens so many times. 1 to 2 days after the blood test, then they get a period. Yeah. Okay, so no blood test. Why would you need a blood test? You've got the two little lines, you're pregnant. Okay. The other area is, so that's the other one, and again I am jumping till the last week for this, the ultrasound as well. I would never advise an ultrasound too early unless you felt that there was, or they had a history of blighted ovum, ectopic. They may have had one ectopic pregnancy already, which means they've only got one remaining ovary and tube. The ultrasounds under 7 weeks were shown in the reports, and I think this is on our website too, that 1 in 7 babies of early ultrasound developed cleft palate or hair lip. Okay, so just be aware of those early ultrasounds. 12 weeks is generally okay. 11, 12, 13 weeks, that's where they do that now, the translucal ultrasound, isn't it? The translucency ultrasound, where they're looking at, or translucal ultrasound, they're looking at the neck and the spinal cord of the baby, and it's quite visible, reasonably visible at that stage, so they can check for Down syndrome. And most women are frightened once they're pregnant. They really are frightened, and they, you know, want to make sure that everything is all right. So you could advise just waiting for that test, and then that's it. Again, unless there was threat of miscarriage, there was bleeding or spotting or Braxton Hicks a little too early. Do you all know what Braxton Hicks are? Yes, they're contractions. They're contractions that are felt pre-labour. And they can be felt from just walking too much, having done too much work in pregnancy. So you don't, and if a woman is having Braxton Hicks, a few years ago the doctors would put them on steroids, on prednisone, would you believe? It's such a terrible thing, and I think still today some hospitals are still doing that. I put them on valerian to calm down the muscles, and it tends to improve any of those contractions, just putting them on valerian. Yeah.
How early can those Braxton Hicks?
They can start from 4 to 5 months in pregnancy, yeah. And some women admittedly suffer. I have had a couple of women who've had Braxton Hicks all the way through. They've been better with the valerian, and even some magnesium, but as well, but still not completely clear. So the ultrasound, yes, that's it. You don't need any other interference. Pregnancy is not an illness. It is a natural part of life, and the more you interfere, the more traumatic the pregnancy becomes. Yeah. The women will come and say to you, I don't know if I'm ovulating. Now, we spoke about you keeping a chart last week. So we have a temperature guide, and we also, okay, so we start generally temperature readings on day 1 of period. You go through to day 14, which is ovulation, and as a rule, day 28 is the menstrual day. This is just on an average. Not very few people fit into that category. Now, on day 1, your temperature is expected to be around 36.5 on an average. But when you get to about day 9, 10, the temperature can actually dip. So you've got these little graphs that you're keeping for your patient, okay, and then suddenly it dips. Okay, it might dip 2 degrees or 0.2 of a degree, and then it starts to climb and it starts to climb. Okay. Now, when you see the dip, this is generally the time that the woman is ovulating. Now, what happens is if the dip comes and it's very light, there's a little bit of a dip, but then there's an incline here. There is very little temperature difference. You don't see this rise in temperature at all, and you don't see a sustained temperature, which you're meant to have for at least 3 days in a row at about 37. Now that's what they call ovulation. You ought to be feeling a bit wet here. Okay, the woman is feeling a bit wet. She's from here, from say day 9, she's also got some gluggy looking mucus. Sorry. But from here, her mucus is thinning down and she's getting very fine, thin mucus. Very watery. And it's those 3 days from the dip that she needs to know that she has enough mucus. Now you really, the older she gets, the drier that cervical mucus becomes. So, but she may still have enough, just 1 day before it dries up. This is what you can do with the kits. Now there are 2 kits. The other one I wasn't able to get. It's called the Maybe Baby kit. Have some of you heard of Maybe Baby? Yes, it's just again like a little tube, a little round tube that you take the morning saliva onto the end of it, and then you look at the other end and it'll have little dots, or it will form a little leaf like a fern, and the ferning is that she's ovulating. And this is a wonderful way she can keep track of her ovulation herself. They're available, I think, only through magazines. I think you can order them through. Oh, do Lifespan have them now? Oh, there you go. Okay, but they're one that you can use forever and ever. So, whereas these ones, you get a 5-day test kit. Okay, it's similar to what we said with the test kit for pregnancy. Every sachet, you just put your urine into the cup. You have a little sachet for each day, and again, it's where the colour will change and will give you 2 colours, 2 marks when you're ovulating, on the days you're ovulating. So it's just a 5-day test kit. For those that haven't got the Maybe Baby, or they don't rely on it, because some people buy it and say, but I'm ovulating all the time, I get the ferns here, I get the ferns there, I get the ferns there. Yes, your progesterone is haywire. It's not consistent. It's you, is it? You get a lot of ferning. Okay, they blame the machine. They say there's something faulty with the machine and it doesn't work, this little apparatus does not work. That's not the case. There's generally a hormonal imbalance and fluctuations according to her blood sugar levels at that time. So that's why you'll be getting sort of irregular readings. So this one would be a fairly accurate way of being able to test during this time. Now, that's we said is an average. These are things that you can show. They're available through the chemist, and the patient can purchase herself from the pharmacy these kits. Whoops. Okay. Let me just show you what I'm finding. The younger the girl is, often the better you can keep a track of her mucus days, because they do tend to have a lot more mucus. What I'm finding with women as they're older, they might have a little later menstruation. They might go up to, say 31 days, and you're keeping track of their cycle, okay, and they're getting their dip sort of around here, right? And you go along and they've got a peak right up to the time they're ready to menstruate, and you think, what's happening? You know, there might have even been a little bit of a dip here, right? But nothing very, you know, very noticeable that it would be enough to say, yes, you definitely ovulated around day 10 here. But it's happening, okay, they're getting their dip later, which would be in keeping with half, okay, because it's generally half the cycle here. But the temperature keeps rising, and they may or may not notice a little bit of mucus here, but then sometimes they notice mucus here. And I say, okay, when do you feel more amorous? When are you sexually heightened? And they'll say, just before my period, or when I first get my period I feel so sexual. Some women are very fertile during their period, or just after their period. So you know, when they're testing with this maybe baby, and I'm saying you can use the ovulation kit, but honestly, if they have access to a maybe baby, that's a simple, easy way they can do it every day. Okay, so they test, but they're generally testing up to here, and then they don't bother because they think, well, I've passed it now, nothing's shown up, I'll have to wait till the next month. And they forget to keep testing close to their period, and you find that they ovulate during their period. Now, who of you have had a look at the Billings method? Good. Did you read what Dr. Evelyn Billings says, how some women actually can hold their egg and their progesterone levels until, because progesterone kicks in, I mean, from day 7 to day 21 you ought to have had adequate doses in there, but actually day 21 and onwards is where you have your holding of progesterone. The older a woman becomes, her likelihood of progesterone kicking in later is most often. Okay, so she really does ovulate a lot later than the average. And what we discovered with keeping these charts of the patients is that they weren't trying just before their period. Even though they felt sexual, they thought they'd save it up, or, you know, husband's sperm, you know, will save it and wait till the next month of the dip, you know, mid-cycle, because everyone said that's when you fall pregnant, is in the middle of the month. Now, this happened with the two girls, the older women that got pregnant with us. In both their cases, we discovered one of them ovulated just a day ahead of her period, and the other one ovulated on her period. So she was then told to make love. They were told to make love at those times. I learned to look for this even before the Billings method, because my neighbour across the road had tried for 7 years, like 40 years ago now, to conceive, and never happened for 7 years, and she went to doctors and everywhere, and finally went back to her home country, and in the monastery in Greece they have very ancient people teach ancient classical Greek, where they look at the time of your birth and so on. And this priest, this bishop or pope or whatever he was there, they've got all these hierarchies in their priesthood, he found that she was ovulating right in the middle of her period, and only 1 day a month. So he told, and of course that's an unclean time, you know, you wouldn't be really so messy, you know, don't necessarily feel like making love at that time. So she did, and of course she had George. you know, and then she planned Maria a few years later, you know, right in the middle of her period. Wasn't it great when you know? What Francesca Nash does say is about the full moon babies, you know, that does make some sense. You know, when you look at people born on a full moon, their ovulation is never the same as someone who's born outside that full moon. They have also full moon babies tend to have a little more problems conceiving. They don't ovulate every month the same, or even every month. Yeah. I just, and saying that, I didn't understand totally her book when it came out on I read it when she first put that book out. What was it called? The Moon Diary or Moon Charting or something for your hormone cycle, and I didn't quite understand it, but it made sense what she said because I was also a full moon baby with my history, and I thought, okay. Then questioning with my patients, and then having an ephemeris sitting there that I could look back and see if the patient, if they didn't know what their time or birth was, and I'd look it up, and yes, it happened to be a lot of couples actually having difficulty conceiving tend to be full moon babies as well.
People do ovulate more than once in a cycle too, don't they?
Yes, they can. Very fertile women. There are women who go on the pill and they conceive. There are women who have tubal ligation where their tubes are clamped and they somehow get pregnant. I mean, but they're very rare. But these are the oddbods that we hear about them, you know. They're so super duper fertile, you know. Yeah.
Sorry, one more thing. With the maybe baby, I was noticing, because when I first started doing it, I was doing it in the morning, and I'm thinking, I don't ovulate at all. But then I started doing it at night, and that's when I picked it up.
Yes, yes. Again, it depends on your blood sugar levels too. Yes. See, that's what I mean too. A younger woman tends to have lots of secretions, okay? Like anyone, you know, you've got an abundance in there the younger you are, as a rule. As a rule, we're not everyone we know is not the rule, but so you expect that they're going to be ovulating once, maybe sometimes twice in that month. Again, you can predict with the temperature chart, you'll be able to see that yourself if she's having 2 dips and 2 surges. That's LH factor, which is the luteinizing hormone that's supposed to kick in here. From day 1 of your period, you've got estrogen, right, which should actually peak up and then dip. And then you come in with this hormone here, which is your luteinizing hormone, and then you come in with your progesterone, okay, and the latter phase converts back to estrogen. Yes.
Is it the luteinizing hormone that causes this?
Yes, yes it is. But you need to have enough estrogen to push it. Before that climb, before that surge, that luteinizing hormone needs to dip and then be pushed right up. And the greater the push, the better your chances for fertility.
And it's the estrogen that you're requiring?
It's estrogen just prior to it. You need a really good estrogen surge, and then that's what then progesterone takes over. Yes.
And then if you can see, if the progesterone stays high.
It stays up. The temperature, once you conceive, the temperature stays at about 37. But I use the wild yam cream. If there's a threat of miscarriage, if their temperature, they got pregnant but you saw that their temperature wasn't really good, I would come in with wild yam cream and the chaste tree, the Vitex agnus castus, to support it. That's where the strengthening connective tissue is so important, because after recurring miscarriage, similarly to abortion or D&Cs or curettes, the area does become weaker. With any further miscarriage, the whole area gets weaker and weaker. And it could be that you just need to strengthen the connective tissue of the abdomen. You need to strengthen the womb. What herb, is marvellous for strengthening the womb when it looks weak and sagging and falling? squaw vine. Squaw vine. It's absolutely marvellous for holding and supporting. But then you still need your progesterone-based herbs with that. And chaste tree, the vitex again, would be very valuable here. Helionis or false unicorn root is also marvellous with that in strengthening the womb, keeping the baby, holding the baby. But you've got to have enough in the system. You've got to build up and help that system. The mineral SCF, silica and calcium fluoride, I think I mentioned that to you before. That's also important if there's connective tissue weakness, where the abdominal muscles are weak, because maybe there's nothing wrong with the baby. Truly, there may not be a problem with the child. It may be that the abdominal muscles can't hold. The uterus or cervix itself is weak. There's no tone or elasticity there. So these things in preparation for conception have to be placed, have to be put there. Okay, the chart's on page 27. Hormone changes during the normal menstrual cycle, and they are taking this on a 28-day cycle. Okay, so you'll be able to see that your luteinizing hormone, it's nourished by estrogen. It is nourished by estrogen. It peaks, you see that, and then it drops. But if you have a look at when it's most available, estrogen's most available, look at the yellow graph at the bottom. Progesterone kicks in later, but it needs to have adequate amounts of progesterone to push that temperature up as well, and to sustain it, to hold a pregnancy. You've got to have adequate levels, and if you don't, they drop back down. They drop down too quickly. So you've got a temperature that does this, and it comes up, but then it just drops again, and you've got all these variations to it. Okay, until you menstruate, it'll drop back down again, and then you'll bleed. Now, that's not good enough. You know, sometimes it's just a very light, you know, like this. Really not good at all. There's not enough. And sometimes it's just after the period. They dip at day 2 and 3, which they're still menstruating on, or day 5 and 6. They've got a temperature about here, and then they dip here. And then they go up a little bit, but then they come down again, and they may go up a bit and come down again. And this is showing irregularities in their cycle. They do need to have a fairly good flow with their cycle, and they need 3 of them in a row to then be quite sure they're going to conceive. Generally, the body knows how to do things itself as long as it has that balance and that regularity, and you get 3 happening together, one after the other, good cycles, and you're home free usually.
So if that happened and the person did fall pregnant on the low there, would they abort if the temperature came up with the
Yes, if the temperature dropped back down, the baby would come away, is what normally happens. If the temperature doesn't sustain at 37, or close to 37, if the mother herself is generally a colder, weaker person, where her average temperature is not 36, but say 35.8, 35.9, which some women are. They have their basal temperature sits at 35 something. So you're going with her averages. You have to go with her average. So you start with the basal temperature, and this is taken orally. Okay, so this is orally during their bleeding time. So they've got a bleed from say 1 to 4 to 5. Okay, so this is their bleed here. Okay, so this is where you take oral temperatures, but as soon as the bleed stops, you start with vaginal temperatures. And the vaginal temperature, as I said, you can use the old-fashioned mercury thermometers, or you can use these modern little gizmos, which are really very good. You just press it. Okay, it comes up then with a on. Just pop it in, and a moment later, just a moment, and it gives you a reading. And that's quite easy to keep in a sterilised bowl of water and keep it clean. Okay, and they're available at the pharmacy. So this is very good. They need to take their temperature before they get out of bed of a morning. So before the feet touch the floor, before they pass water of a morning, they must take their vaginal temperature. And if they're shift workers, that's where it gets very hard, because it's very hard to get a regular temperature guide. Because if you can say, well, look, mostly in the middle of the day I'm, in bed or up, middle of the day is still where their body has been moving and active, and you're not going to get a good reading at all. So, shift workers, it's very hard to track, and it's also much harder for them to conceive.
Using those ear thermometers isn't good? No. The ear ones are very good for children, though, particularly because they're more likely to get upper respiratory problems, and so it's the head, face, and ear, and you're in very close proximity to where the infection is. But we're looking at vaginal, needs to be a very even temperature to get a good reading, correct reading. Yes.
I have one of those thermometers, and I found if I leave it in for a full 5 minutes, I get at least a 0.2 or 0.3 higher than when the buzzer goes off.
Oh, really? Yeah. But as long as you're consistent, though, that's all that matters. Yeah, do it the same way each time, and at approximately the same time of morning. Yeah, then you'll get a fairly accurate reading. Yeah. When you've just woken up, your basal temperature is lower anyway, okay, and you've got a certain amount of mucus from that night. And once you've had it in there for 5 minutes, your body's awake, so your mind is already kicking over, so your gases and your acids are already on the move, even though you haven't jumped out of bed. And even 5 minutes later is enough to put thought in. So it will be affected, yeah. But movement certainly will affect your temperature. Yeah. Okay, so oral temperatures, vaginal temperatures. What else did I need to tell you about this phase? Yes, the holding phase with your luteinizing hormone, with your FSH levels. People with FSH, you've heard of follicle stimulating hormone. When they have very low levels of progesterone, where you can see that maybe they're not ovulating, you've noticed that you've looked at their chart, the whole 3 months are on detox, plus perhaps 1 or 2 months on a fertility program, and look, they're not showing mucus at all. They're telling you there is no mucus. They're noticing that there's no thorning on their maybe baby. You need to have a look at their FSH levels. Now, this is where you possibly would send them off to have a blood test done. If 3 months detox, then they've tried a natural cycle, then they've gone 2 months on a fertility program and nothing's happened, and they're showing, it's different if things are happening, things are getting better, periods are better, blood flow's easier, no cramping, no breast pain, all the normal menstrual problems are now out of the picture, you're on the path. But if they're saying, no, I'm the same, I'm not showing mucus, I haven't got enough discharge and so on, you may be best getting a blood test done, because their FSH levels, their follicle stimulating hormones, may be just a little too high, and that's what comes into the classification of a perimenopausal cycle. And some women are showing menopausal symptoms earlier than they need to be. Often it can be brought back into balance, though, with herbs. By the way, if I can explain then some of the herbs that improve as we go, because if you're looking at their estrogen days and they have an irregular cycle, they have irregularity and they have suffered irregular periods for the last few years, then you can even start just with a hormone formula called Barzhen-1. Barzhen-1 is 5 3 times a day. There's 200 pills in the bottle, and they're generally about $5 a bottle. So they're relatively inexpensive to keep in the clinic and have on hand for these irregular menstrual people. I find that if they've got a regular basal temperature, an irregular period, and not enough flow for the luteinizing surge to occur, then I give them Barzhen-1 just in the first half of the cycle, or just the first quarter, from day 1 of the period to, say, day 9 or 10. That's the only time they'll take Barzhen-1.
That's if there's not enough of a surge.
If there's not enough of a surge, or even not enough of a dip, or not enough mucus. They're telling you, no, I don't notice any mucus. I'm a bit dry. Now, the other herbs that can be given to improve mucus are Shatavari. I think I've mentioned that to you before. Withania. Peony is very good too. The herb peony. I don't know how many of you use it. Again, it's a Chinese herb. Peony. Rehmannia, and of course Rehmannia, cured Rehmannia, you'll be using in your practice. Cured Rehmannia. So use these if you think they need a prolonged mucus flow, and you really do want to increase their ovulation time if you can. Yes, it's quite phonetic actually. Shatavari. Now, just have.
High estrogen then, have they these herbs?
They also have progesterone. They have estrogen and progesterone. They're very balancing to the hormone system. Rehmannia is a kidney lubricant, a tonic for the kidney and the adrenals. See, these are also the herbs that if they are going into an early menopause, if they're not ovulating, if they're starting to show low temperatures all the way through, then you'd come in with these herbs. They're very nourishing, but they're moistening, and you need moisture. Okay, look at your page 23A of the first book, which is 2 pages after the graph that you just had in your hand, 2 pages after. And have a look at the mucus here. Now, sometimes that mucus does not thin out. And people say, I do get the mucus, it's very yellowy, lumpy, it sticks to my undies, but it never thins out, or they don't notice that it gets stretchy. I mean, not everyone's going to touch it, but you usually can see when it thins out, it gets quite like egg white, very thin and stretchy. Now, if it's thick and it remains thick, the sperm can't penetrate, it's too thick. You need to use manganese. Manganese will help to thin out the mucus. You might only need to use it for half the month. You may keep them on it for a couple of months, depending on the age of your client, but it definitely will help to thin out the mucus. Now, what Louise mentioned was, okay, what about the, my ferning is of an afternoon, and not in the morning when you're normally checking it. That's where you find if she's not, you really ought to be getting your temperatures right in the morning. Okay, there's an imbalance. So we're trying to correct that imbalance with herbs, so then that you can get the correct readings in the morning. But as she said, if her temperature is only good of a night, she notices a ferning at night, and it's dried up by the next morning, or it's dried up by, checking it at midday, it's there, but by night it's gone, then she was only ovulating for those, that short time. Perhaps the egg itself is not viable. It was not enough to sustain a good production. That egg itself did not have good production. Okay, so you're going to then look at the herbs that will assist in her being able to carry a good flow, a nice mid-cycle drop of mucus, the two kinds of mucus, nice peaks and sustained peaks. And this formula I'll give you is the one that I've used for many years, and in 40% of average infertility, what we call functional infertility, it works absolutely marvelously.